Welcome to the Oakland County Megacast. I'm Tyler Kieft, welcoming you to our live, daily, 5 days a week look into all things Oakland County. We'll go very soon to the Oakland County office in Pontiac for a live press conference involving the Oakland County Executive, David Coulter. He will be addressing the monkeypox in Oakland County. Oakland County currently leading the state of Michigan in monkeypox cases, the highest amongst any other county in the entirety of the state. He is forming a task force in Oakland County to address the outbreak. At this time, not a large outbreak, not necessarily something of great public concern, but certainly some lessons have been learned from the COVID-19 pandemic and, of course, the time leading up to the COVID-19 pandemic in terms of what needs to be done in order to prevent a significant outbreak of any sort of disease in the county or in surrounding areas. That press conference scheduled for 10 o'clock, but these are government press conferences. They rarely go right away at 10 o'clock. We'll get to that as soon as it begins, and get to that via Facebook Live. Oakland County Executive David Coulter will be speaking on this. We also have Larry Nilan in our older studio at the office of My Michigan TV with us on the Megacast. It sounds like in my ear that the press conference is beginning, so we will go now live to Pontiac for the Oakland County Executive's press conference.
Well, so they're doing contact tracing, on those cases that we know of. They're also trying to get information out to the public, which is part of why we're here today, and to determine exactly where this virus is spreading and what we can do about it. So this is a new virus to Oakland County and to Michigan, frankly. This has previously only been seen in virus, but the good news is it's not a novel virus like coronavirus, right? So we do have vaccines. We know a lot about this virus. We know how to attack it, and we have the ability to do so. Part of the problem is we don't necessarily have the supplies we need at this point to do so, and so that's something else I want to talk about today. So as I said, I certainly don't want to be alarmist today, but we must be prepared for this potential spread of this virus across our state. Oakland County has seen the largest number of cases so far, and as you'll hear from Dr. Benson in a minute, the population of individuals most at risk of getting monkeypox at this moment is far greater than our capacity to vaccinate them. And so that's part of the reason that I am concerned. So that's why I'm forming a task force today to prepare for what may be to come. It's going to be led by Oakland County's health officer, Calandra Green, and I'm very excited about her willingness and enthusiasm to take on this project. And they're going to help develop communications and an education plan for our residents. They'll also create a plan for vaccine distribution when that day comes, and more widely. Because we know that the number of cases are going to increase. We've seen it in New York City, for instance, and our population isn't the same as New York, but if you look at New York, it's going to increase here. In New York City, the number of cases has doubled in more than a week, so that's the potential. Our numbers have been increasing exponentially too, again, much smaller, but on the same kind of exponential scale. And the number of vaccine doses, as I said, has been woefully inadequate, both in New York City and here in Michigan. The federal government, let me give you some statistics around that. The federal government has allocated only 1,800 doses to the state of Michigan. We have enough here in the county to vaccinate 350 people. And because of that small number, we are not delivering preventative vaccines to people yet. That is happening across the country in some communities, but we don't have the supply to do preventative vaccines. So rather, we can only treat people who have already had a known exposure to the virus. And our supply of TPOXX, which is the drug that's being used to treat severe cases of monkeypox, is an even shorter supply, with enough doses to treat 4 people. Those are alarming numbers to me. Now, we are expecting more doses of the vaccine, so that's the good news. The vaccine is Jynneos, and we're expecting more by the end of August, which is good news. The pharmaceutical companies, I understand, are gearing up production and are expected to have significantly more by October. So our challenge now is what happens between now and then, right? Because frankly, that's not good enough now for what we know is a virus that we can nip in the bud if we have the resources that we need. So one of the things I want to say today is I am urging the federal government and the Centers for Disease Control to expedite that development, the production and distribution of the drugs that will help prevent and treat this emerging virus. It's critical that we do that. And I'm thankful that we have a strong partner in Washington, D.C. I was on the phone yesterday with U.S. Senator Debbie Stabenow's office, and I know that she's echoing that urgent need in Washington and with the CDC. So, in the meantime, we want to let our residents know what to look for, how to get treatment if they have been exposed to monkeypox. You know, the good news, I guess, is that we're so much better prepared now that we've been through COVID. Not that we didn't have a strong health response before, but COVID has taught us a lot. And the dedicated employees here in our health department have become experts at contact tracing, and they're using those skills to track possible exposure with monkeypox. They also know how to set up
slight technical difficulties. We'll get back to Pontiac in just a moment. You can still hear it under me right now. Just making a couple of adjustments so we can have as smooth of a broadcast of this press conference. Again, Oakland County Executive Dave Coulter in his office in Pontiac addressing monkeypox in the Oakland County area. Currently, Oakland County, the highest number of monkeypox cases in the state of Michigan among all other counties. And in terms of vaccinations, which are known to be able to eliminate this particular virus, currently 1,800, as Executive Coulter said, in the state of Michigan. Only 300 of those vaccines are right here in Oakland County, and they're not being used for preventative measures. We go back to Pontiac now.
By the monkeypox virus. Infections with this strain of the monkeypox virus identified in this outbreak are rarely fatal. However, with anything else, just like COVID, people who are immunocompromised are more susceptible to severe illness. So what are some symptoms of monkeypox? Some folks present with a rash and flu-like symptoms. Rash are raised areas that can be very sore and very painful. Fever, headache, muscle aches, body aches, swollen lymph nodes, chills, and exhaustion. You can present with either a rash, or you can present with fever-like symptoms, or you can just have a rash without fever-like symptoms. Oakland County Health Division and our team are diligently working to contain the spread of monkeypox. We're creating a task force, as Mr. Coulter alluded to, with our community partners and key stakeholders to really get in front of monkeypox, to raise awareness about prevention, vaccination, the importance of educating the community on those prevention measures, and how to seek treatment promptly to reduce symptoms. We are collaborating directly with the healthcare systems, primary care physicians, Michigan Department of Health and Human Services for suspect cases of monkeypox in the Oakland County region. This collaboration helps us to swiftly provide guidance to plan next steps for coordination of care. Supporting and educating physicians who are caring for individuals who are presenting in their offices with suspect monkeypox, and guiding them on how to properly and quickly collect specimens for testing through the Bureau of Labs and other participating diagnostic services. Case investigations. Our team of epidemiologists and nurses in our communicable disease department are working really closely with the state for any suspect cases. And when those cases turn to probable cases, we are quickly contacting those cases, getting information about their whereabouts, their activities, and any travel history, so that we can quickly determine those close contacts. It's really important to determine close contacts in the early stages of case investigation, notify those individuals so that we may bring them into our health division and to treat them with the vaccine that is provided to treat monkeypox. And then, of course, working with our state partners to make sure that information is collected in the database so we were able to quickly identify any outbreaks within our county. And then vaccination. We know the sooner that a person presents with exposure to monkeypox, the vaccine is very important between the first 0 to 4 days to reduce any symptoms or infection of monkeypox. In the United States, there is currently a limited supply of Genios, as Mr. Coulter alluded to, although more is expected in the following weeks and months to come. People that are vaccinated with Genios, that are close contacts of the monkeypox vaccine and have been exposed to a positive person, it takes 2 doses, 28 days apart for full vaccination to occur. The monkeypox vaccine is part of the strategic national stockpile. The vaccine strategy determined by the CDC and the state, only vaccinating close contacts at this time because of the limited supply and the scarceness of the vaccine. In the near future, this supply may increase and the national vaccine strategy may change as a result. We're dedicated here in the Health Division to make sure we educate the public, educate any of our key partners that we're working with. Sorry about that. Please contact our nurse on call at 1-800-848-5533 for information about monkeypox vaccine prevention, treatment, where you can go to seek support, and also you can look on our website at www.gov.com/monkeypox. At this time, I'm going to turn it back over to David Coulter, but I do want to mention one thing, that we will continually work with the state and our local health services to limit the spread of monkeypox virus and to educate our community about the ways to prevent the spread, identify suspect cases, and pursuing prompt testing and contact tracing. Thank you. Mr. Coulter?
So thanks, Calandra. Appreciate that. I'm also really happy to be joined today by Dr. Paul Benson. Dr. Benson's an infectious disease and HIV specialist and the medical director of the Be Well Medical Center in Berkeley. He has seen most, if not all, of the cases that we've had so far in Oakland County. He is uniquely qualified to talk about this, and he's agreed to join our task force, so I'm very grateful about that. He's been a doctor working in the LGBTQ plus community since 1980. And he's the only doctor in the region that we're aware of that's authorized by the CDC to actually prescribe TPOXX. So he is uniquely qualified, I think, to help lend his voice and his long years of experience at fighting this new infectious disease. Because we don't have adequate supplies of doses yet, we have to be smart and strategic about how we respond to the spread of this virus and make sure we're reaching those who are most at risk for contracting monkeypox. So here to talk about that is Dr. Benson. So thanks, Doctor.
Thank you, David. Good morning, everybody. It was a couple months ago that the Center for Disease Control sent an advisory to all physicians about monkeypox, and most of us probably looked at it and filed it away. In that advisory, it said that physicians need to start looking for monkeypox as a differential diagnosis in people that present with symptoms of monkeypox. In that statement, it stated that you should think of monkeypox in the appropriate individuals irrespective of their sexual orientation or their gender. Monkeypox was first identified in the 1950s, believe it or not, in monkeys. It then transferred over to humans sometime in the 1970s. And the reason I bring up this history is important. As David said earlier, it was identified in Central Africa. At that time, there was no predilection for it affecting gay men. A matter of fact, gay men were very few, if any, of the cases in Africa. So something has changed, because when monkeypox escaped Africa, it was there for many years, it now is affecting gay men. I can make a hypothesis that perhaps a gay man or a group of gay men traveled to Central Africa. They were in the wrong place at the wrong time and somehow contracted monkeypox, came back to North America and spread the disease to others. Monkeypox is the disease that keeps on giving. As David mentioned earlier, it spreads exponentially. And it can even start spreading before you really have symptoms. Now, a lot of people talk to me about the correlation between HIV and monkeypox or COVID and monkeypox. I'm confident that monkeypox is not going to be the last epidemic of viruses that we're ever going to see. We need to continually learn from previous ones and get better and better at what we do, and I honestly believe, that we are doing that. You need intimate contact to spread the virus. You have to have the lesion, and you have to touch somebody else that has it as well. I'm concerned that people may label monkeypox as a gay disease. Again, it's been in Africa 30, 40 years. There's no predilection to the LGBTQ community. I'm a little concerned because it is spread through sexual contact that people not understanding the LGBTQ community may think that these individuals are people that are sleeping around with multiple numbers of people, and that's how it's spread. And that is partially true. But I want the message to be very, very loud and clear for people that really don't have an understanding of the LGBTQ community, that not every gay man or transgender woman or lesbian sleeps around with a number of people. We are capable of loving, lasting, monogamous relationships just like everybody else. And I think that's probably one thing that we have to understand and learn from our history, because that was a mistake in HIV epidemic. I was there in 1980. And I think the LGBTQ community got a bad rap at that time. So we need to remember this could have just as easily escaped Africa in a heterosexual manner. And I believe if we're not careful and if we don't use common sense, it will cross over to other populations as well. What we all need to do, physicians need to listen to the CDC and do proper vigilance in screening people and listening to them about the possibility of them having monkeypox. And in the lack of having a good vaccine in plentiful supplies, we have a good vaccine, it's just not in plentiful supplies. Lay people, whether you're gay or straight, need to do one thing we're all capable of doing, but we don't always do it well, and that's have common sense. Until we can get everybody vaccinated, is having symptoms of monkeypox, whether it be the characteristic sores similar to influenza, is probably not a good time to be intimate or close to other people until that problem is identified. Human behavior, this is easier said than done, but that's one thing we need to spread the word out. Don't live by those 5 words. Maybe it will go away. If you have an issue, act responsibly to avoid spreading it to others. Similar to what we're doing. And what is different with monkeypox as compared to COVID or HIV is that we can eliminate this virus with an aggressive vaccination program. We can, right now, we cannot do that with HIV. The virus mutates. We can't vaccinate our way out of COVID. We've tried. We see that the virus mutates and the vaccines are not anywhere near as effective as we would like it to be. Monkeypox is related to smallpox. Smallpox vaccines, if you're old enough, we've all had them. We've eradicated smallpox. Another virus, polio. We've just about eradicated polio. Maybe it's in 1 or 2 countries left, but very, very rare. So the big difference between monkeypox and these other viruses, we can vaccinate ourselves out of monkeypox. But right now, with a limited supply of it, we have to be very, very smart in who we vaccinate, because we can't vaccinate everybody right now. And we're going to need to stratify who we're going to vaccinate with. What physicians need to do, and most of us don't do a good job at it, is do a risk assessment on all our patients, do a sexual history. Many of our patients have hidden lives that the doctors don't know about, and if we don't ask the questions, we don't get the right answers. If we start taking sexual histories and identify people that are high risk, we could start educating them and perhaps put them in front of the line to get vaccinated against monkeypox. From my understanding, monkeypox is not deadly, but there is morbidity associated with it. There's also a very large financial cost, because if somebody has monkeypox, they need to isolate themselves from other people for 2-3 weeks until all the lesions are gone, and that will lose a lot of productivity for everybody involved. So one of the reasons I agreed to join this task force is because I want to be part of the solution and help develop these guidelines for who should get vaccinated and when, until we have a plentiful supply. And one of the common sense things we all need to do is educate people. It's just not like I'm going to go in and get a monkeypox vaccine, or I'm a gay person, I should get a monkeypox vaccine. If you're a gay person in a monogamous relationship and you're low risk, then you really don't need to be put in front of the line. But if you're living with HIV and you have multiple sexual partners, if we're going to eradicate or reduce this disease significantly, then these people do need to be part of first in line. One thing for certain, and I'm going to conclude with this, if we haven't learned anything but this from HIV or COVID, is science changes. Science is not static. As we learn from our experiences, as we learn from more data, we need to change. And I'm hoping that this committee is willing to change as new data comes in. We're going to have some very, very tough decisions to make as far as who should be vaccinated and when they should be vaccinated. And we can't live with our morals and say we set one way of doing it 6 months ago, and now data has changed and we're not going to change with it. So this is going to be a living project that these recommendations are going to need to be done in real time. I would believe, from knowing the people that are on this task force right now, that Oakland County can be a leader in the country in making guidelines for vaccination. It's not one size fits all that everybody should just be vaccinated. We have to do it smartly until we have so much vaccine available that it's not going to make any difference. We can just vaccinate everybody. So supply is going to determine a lot of that. All right, I'd like to turn this meeting back over to Dave Coulter, and I believe I'll be available for any questions.
Yeah, don't go too far. I'm guessing some of the questions might be for you. So thank you, Dr. Benson. Thank you, Calandra. I hope what you've heard here is a couple of things. Number one, we have to be serious and smart about this. We don't have enough supply to vaccinate our population, which if we did, we could eradicate this virus from our state and our country. So in the meantime, until that vaccination rate increases, and again, I'm urging the federal government and the CDC to crank up production and distribution of that vaccine, because that's ultimately what it's going to take. We're going to have to be smart and strategic about how we address this virus. So with that, I'd like to open it up to any questions for me or Calandra or Dr. Benson. Yes, sir. So the question was, is there a concern that the public won't heed the warnings of the science that we're learning through COVID, and will start to reject the recommendations and that sort of thing? Boy, I sure hope not. That's a great question, because I've said from the beginning that I'm going to follow the science. I'm not a medical doctor. I'm not a public health officer, so obviously I rely on the advice of those folks. But this is a very different virus, and I don't want to speak for those. But what Dr. Benson is referring to when we talk about this isn't COVID or HIV, is because this virus doesn't mutate, right? It's the same virus that it was when it first appeared. So we have the vaccine that can eliminate this, and so and it doesn't have to be for everyone. As Dr. Benson alluded to, if we are smart about targeting the most high-risk individuals, we can wipe this thing out without widespread vaccination. So I think in those ways, it differentiates itself from COVID. I don't know if there's anything you wanted to add. Yes, sir.
Mr. Coulter, are you worried that the creation of this task force will cause concern in the general public? Should the general public be concerned?
So the question is, am I concerned that creating a task force will cause alarm in the community? Maybe a little bit. I tried to say in my remarks that this is not a cause for alarm. These numbers are significantly lower. We probably had 300 cases of infections today for COVID, or yesterday, right? I mean, we're still in the hundreds of cases a day. We're talking about 6 or 7 cases. So I don't want people to be alarmed. And as Dr. Benson said, if you're not in a high-risk category, the likelihood of you getting monkeypox right now is slim to none. So there isn't a cause for alarm. But I do worry when I see the inadequate supply, that we're not prepared as a country to address this as forcefully as we could, and to lose the opportunity to eliminate this virus with what we already have if we can just rank up production. So there isn't a need to be alarmed, and I hope that that's not what we're portraying. But what I want to portray is that we're going to get ahead of this as well as we can. We're going to learn who's getting infected. We're going to learn how to stop it, and hopefully in time so that it doesn't spread throughout the county like other viruses have.
David, can I add something?
Yeah, please, of course.
I guess my virtue of being in practice since 1980, I rely a lot on history. And I think the fact that the task force has been developed and we're talking about prevention, and preventive care is the best care. If I look back into the 1980s with the HIV epidemic, there were over 2,000 cases before it was ever put in any newspaper. And that newspaper that first reported on AIDS was the Wall Street Journal. So I think that, and we made a mistake with that. It was a crucial delay in giving proper.
The live stream. This first one may be a good question for Calandra, our health officer. This is from Tyler Kieft of the Megacast. Is there a particular number of vaccine that the county would consider adequate at this time or in the near future to provide preventative care and or prepare for a greater outbreak?
Hey, you want to handle that one?
Thank you, Tyler. Our role in the task force is to really determine and establish with Dr. Benson what that number would look like, and to ensure that we are working with our state and our federal government to procure the vaccine that we can use to eradicate. So at this time, we don't have a magic number because, as you know, this is very private, this is very confidential, especially when it comes to the LGBTQ plus community. So those numbers are not forthcoming at this point. But our goal would be to ensure that we assess what we need for our county and to start there, and to continue to work with those regulatory agencies to procure what we need.
And this next one from Tyler.
Follow up to that one. Yeah.
Well, a different question for Ms. Green.
Oh, okay.
That's all right. In the course of doing contact tracing, your department contacted some promoters of a popular series of pool parties in Detroit that are popular among gay men. Did your department advise against continuing to hold those parties, and in the coming weeks?
I think what's important to understand about being a close contact of someone with monkeypox is not where you are. It's not related to a specific place. It's really related to making sure that the behaviors in which you exhibit, you are monitoring your body for signs of the rash, which are very prevalent, that you can't miss, and looking for signs and symptoms of flu, sickness, knowing the things that you've done in your private life that are confidential to you, and assessing your body for, just like we do with COVID before we send our kids to school, making sure that our kids don't have fevers and they're not sick. So it really comes down to making sure that you have some individual responsibility, and that if we have contacted you as part of our contact tracing initiative, that you've been exposed to someone with monkeypox vaccine, is to work with us to quickly vaccinate you if we determine that you are high risk for contracting the monkeypox vaccine. So we're not shutting down any services, any businesses. We're not encouraging businesses not to participate in activities that they've participated. It really comes down to prevention and knowing your body and monitoring your symptoms and really seeking care from your healthcare provider if in fact that you believe that you've been exposed and or you start to develop any rash or any symptoms of monkeypox.
Thanks. Yeah. Bill, you have another?
Tyler had another question. This could be for Dr. Benson or Calandra. But if and when we have adequate vaccine that we can do preventative vaccination, how will that distribution eligibility be determined?
Well, I'm going to just jump in and answer that one because that's what this task force is going to help to evaluate. It depends on how many vaccines we get. That will determine how broadly we can distribute it. And so that's what those are numbers. That's part of the reason we're having this task force, is to determine how many we get, who should get them, in what order. Other questions?
Your experiences, especially with the early stages of COVID, kind of inform your experiences and future ones.
Yeah. So he mentioned I've been the executive for 3 years. We've been through COVID. How does that inform my experience here? Well, I'm certainly on heightened awareness. Not that our public health department isn't always very alert and aware for diseases and viruses in our community, and we always try to have the most robust response we can. But sure, having been in office for 6 months when COVID hit and watched this team work and worked through that virus, which we're not through yet. We're certainly, I would say, on heightened awareness that the earlier we begin to get serious about addressing these things, the better chance we have of defeating them, if that's and in this case that is the right word, because we can defeat this virus. So it certainly have a heightened awareness of that. Thanks. Yeah. Yes, sir. Yeah.
Can you just further elaborate on why heterosexual people should be or should pay attention to what's happening with monkeypox?
You know what?
Sure.
The question is, why should heterosexual people still be, elaborate on their risks and whether they should be a concern? Yeah.
So the virus doesn't have a brain to choose going after LGBTQ or heterosexuals. My personal opinion is that probably gay men are having more multiple sexual contacts than heterosexual men are. Maybe true, maybe not true. It's my feeling. And sooner or later, there's going to be a crossover. Perhaps the non-binary people or the bisexual people, there's going to be a crossover. So the straight community cannot just sit back and watch this, probably something similar to what they did in the 1980s with AIDS. It's going to cross over. The question is when, and the question is how quickly we can get the vaccine out to end this epidemic. We certainly could do it. But I think the heterosexual community needs to follow the same principles with risk reduction as the gay community does.
All right. Any last questions? All right. If not, I appreciate your time this morning. Thanks, everybody.
We appreciate that. Is Dave Coulter, Oakland County Executive, live from Pontiac at the Oakland County offices, giving a press conference this morning about a new task force formed by the executive regarding monkeypox in Oakland County. At this time, Oakland County has the highest number of monkeypox cases in the state of Michigan, and vaccine availability at this time to help treat monkeypox as well as to help prevent monkeypox cases in the county very, very low. Only 1,800 vaccine available for monkeypox in the state of Michigan. That's, to be exact, as of Wednesday, that number was 1,806. 340 of those were available in Oakland County. So just over 300 available vaccine at this time. And as Executive Coulter had said, and as was mentioned by others on the task force that spoke at this press conference, those vaccines are not being used at this time for preventative care. They're only being used to treat cases of monkeypox here in Oakland County. We have Larry Nilan also with us on the broadcast now. He is standing by in our office at My Michigan TV. Larry, welcome. Thanks for joining us.
Thank you, Tyler. Yeah, this made me think about, it was about 2.5 years ago that we came on the air just as COVID was breaking. In fact, it's what kind of formed this program, the Megacast. And it seems like this is, it has some similarities, but it's not the same in that this requires a lot of really close contact with someone who has it in order to catch it. But people are catching it in Oakland County right now.
Yeah, contact with someone that has one of the rashes or lesions or other visible symptoms of monkeypox is how you would spread. Then you need to isolate yourself. So and the isolation in this is much different than it was for COVID. For COVID, at the origin point of that pandemic, it was about 2 weeks monitoring your symptoms, regular testing, seeing where you were at, and maybe even before the end of that 2 weeks, you'd be cleared to go back out into public situations, of course, taking the precautions that were suggested and at that time required in many places. This is very different. You are isolated for at least, I believe it was 28 days, about 3 weeks, 3 to 4 weeks, as was said in this press conference in Oakland County from one of the members of the task force, Dr. Paul Benson, who's the medical director at the Be Well Center in Berkeley, one of the many members of this task force. Again, Oakland County forming a task force to tackle monkeypox in Oakland County, where the largest outbreak of cases in the state of Michigan currently resides. And I'll just go and touch on some information from a great article we have posted on our website, civiccentertv.com, on our local news page from Christina Hall at the Detroit Free Press with more background information. Michigan.gov/MPV is the state's website for monkeypox. You can go to oakgov.com to learn more information about monkeypox from Oakland County here locally. As of Wednesday, there were 19 confirmed cases of monkeypox in the state of Michigan. 8 of those are in Oakland County, 4 in Detroit, 3 in Macomb, 2 in Kent County, and 1 case each in Wayne and Washtenaw counties. That's according to the Department of Health and Human Services at the state level. And so in Oakland County, what their concern is, and the reason why the executive, Larry, has formed this task force, is because they want to get out ahead of monkeypox as quickly as possible. Really learning from those lessons of COVID-19. The better prepared you are, the better you can address the issue. And what was really striking to me at the beginning that shows the clear difference between this and the COVID-19 pandemic, or at least the origins of that pandemic and the outbreak here in Oakland County, is this isn't a novel virus. The medical community has known about this for a number of years. They have that knowledge behind, so they kind of have a blueprint for ways that they can prevent these cases.
Yeah, and Tyler, I know you mentioned that there has been a task force that was formed, and a lot of people who are friends of the Megacast here, Dr. Russell Faust, Dr. Paul Benson, who we heard from earlier. Another member of the task force is Affirmations Executive Director Dave Garcia. And I think if we take a quick break here, we're going to be able to have Dave join us here in just a moment.
Okay, Dave Garcia, one of the many members of this task force. We'll go through just a brief list of those members right now. Of course, Oakland County Executive Dave Coulter, highly involved. Also, Dr. Paul Benson, medical director at the Be Well Center in Berkeley, who we just heard from at that press conference. The Be Well Center, for reference, serves a large segment of the LGBTQ plus community in Oakland County. Oakland County Medical Director Dr. Russell Faust, also on there. Affirmations Executive Director Dave Garcia, who we will speak to after this quick break. In addition, there are representatives from the Corktown Health and Hazel Park, a representative from the MDHHS as well, and additional task force members are expected to be named soon. That is per a news release from Oakland County. We'll take a quick break on the Oakland County Megacast. When we come back, Larry and I will return. We'll speak to Dave Garcia from Affirmations. This is the Oakland County Megacast.
Made possible by the COVID-19 vaccine. Keep the festivals going by keeping yourself protected and your COVID-19 vaccines up to date. Now that the vaccine is available for children 5 and up, why do you recommend it?
Kids are part of the community and they can spread COVID.
We're seeing both healthy children getting sick from the virus as well as children with underlying health conditions.
They can easily bring the virus home to other people that are vulnerable and make them sick as well.
This vaccine can change that and keep children safe.
It's essential that your children get vaccinated to protect them, to protect your families, and to protect those in the community around you.
Let's savor these moments, made possible by the COVID-19 vaccine. Keep the dining out going by keeping yourself protected and your COVID-19 vaccines up to date. Can I ask you a question? Why do you want to get the COVID-19 vaccine?
I don't like getting sick. The virus will die. It will be easy to not catch it. Keep my family safe and keep playing soccer. Because I love being vaccinated.
What's your hope for everyone?
I hope everybody gets the vaccine to keep safe and strong. Be like happy, having fun everywhere. Everyone stay safe and hope you get the vaccine.
Wondering what to say to someone who's been sexually assaulted or abused?
I believe you. I'm so sorry this happened.
It's not your fault.
Confidential and anonymous help is available at the Michigan Sexual Assault Hotline. Connect with us 24/7. Call 855-VOICES-4 or text 1-866-238-1454 for help. Learn more at michigan.gov/voices4. Let's relish these moments, made possible by the COVID-19 vaccine. Keep the festivals going by keeping yourself protected and your COVID-19 vaccines up to date.
Welcome back to the Oakland County Megacast. I'm Tyler Kieft, welcoming you back to our live 5 days a week look into all things Oakland County. Of course, this morning, Dave Coulter, the Oakland County executive, held a press conference in Pontiac to announce the forming of a new task force to address the monkeypox outbreak in Oakland County. Not something of great concern necessarily at this moment in time in terms of public spread or a major threat to the community, but something that the public health community in Oakland County definitely wants to get out in front of and prevent further spread, as Oakland County currently leads the state of Michigan in a number of cases of monkeypox in the state. We're also joined by Larry Nilan from Civic Center TV and My Michigan TV. And now we're joined by Dave Garcia. He is the executive director of Affirmations, located in Ferndale, joining us on the Oakland County Megacast. Dave, thanks for being with us today.
Absolutely. Thanks for having me.
Dave Garcia, also a member of the task force formed by Oakland County Executive Dave Coulter to address monkeypox in the state of Michigan. One of the big points that was made in this press conference, and that, particularly from Dr. Paul Benson, who's the medical director at the Be Well Center in Berkeley, was the impact that monkeypox, as it's been spreading in the U.S. and around the world, is having on the LGBTQ plus community. partly because it seems to be having a larger impact on this particular community than other communities throughout the world at this moment in time, but also because this draws parallels in some cases to what we saw in the 80s with the initial outbreak of HIV/AIDS and the mistakes that were made by governments around the world. In your discussion so far with members of the task force, how much of a factor is that playing into making sure that Oakland County gets this right, particularly for those in the LGBTQ plus community who at this time are currently the most heavily affected by monkeypox?
Yeah. Very important for us to not label this a gay disease. This is not a disease, but we also have to be realistic that it got a head start in the LGBTQ community. And so we have to do our best as leaders to protect our community, the LGBTQ community. But we cannot make the same mistakes of the past because, again, this is not a gay or straight disease. It just got like I said, it got started, it appears in our community, and so it is in our community, and we have a responsibility to protect our community from it.
We're joined by Dave Garcia. He is from Affirmations, located in Oakland County. He's also a member of Oakland County's task force addressing monkeypox as it spreads in Oakland County. Currently, 8 cases of monkeypox in Oakland County, 19 total in the state. Oakland County, highest number of cases in the county. So Dave, this is a new task force that's been formed by Executive Coulter. What discussion have there been any meetings formally of the monkeypox task force in Oakland County thus far? And so far, where are the conversations, if so, focused on as the county addresses this issue?
Sure. We have not had our first meeting as of this point. We are in communication. I happen to be on vacation right now. I'm actually joining you from Portugal. And when I get back, I'll be back in Ferndale on Friday. And I believe our first meeting is scheduled for Monday at Affirmations. So we are trying to do this as quickly as possible so we can get information out to our community. You know, before I left on this vacation, I think it's interesting to note that I tried to get a vaccine in my country at Be Well Medical, and they did not have the vaccine. And then ironically, when I was in Montreal for a week, they set up shop in the middle of the gay village, and I said I'm an American citizen, and they said it doesn't matter, and I got my shot in Montreal. So I was not able to get vaccinated in the United States, but was able just 2 weeks ago vaccinated in Montreal, Canada. So what we really need right now is more vaccines so that we can get out ahead of this. Right now, they're only giving vaccines to those that have already got monkeypox. So we need to make sure that our community, the LGBTQ community especially, because that's where it is spreading right now, gets vaccination, gets vaccine. Affirmations has been doing COVID vaccinations for a long time now. We and our community partners like Corktown and others, Be Well Medical, can get people vaccinated, but we need the vaccine, and that's going to have to come from the feds.
So Dave, can I ask you about the experience of getting the vaccine? Did you have any side effects from it at all?
I didn't. No, they said much like COVID that I might have fever, but I didn't. A sore arm, but nothing big at all. And I thought it was great. It was very easy. Again, what I was most impressed with in Montreal is that they set up tents right in the middle of the street of the gay village, and we're giving away the vaccinations. We're giving vaccinations for free to the citizens there in Montreal.
We're joined by Dave Garcia from Affirmations, located in Ferndale. Joining us on the Oakland County Megacast, Dave is also a member of the new Monkeypox Taskforce that's been formed by Oakland County Executive Dave Coulter. And Dave, as you're addressing this issue, particularly from your point of view, being that you are leading an organization that advocates for the LGBTQ plus community, on the one hand, you want to make sure that this community that's being so heavily affected in terms of the full numbers of COVID of monkeypox cases in Oakland County at this time and in the world at this time, that they're being safe and being careful, taking the proper precautions. At the same time, you want to make sure that this community that is a marginalized community is still able to have that kind of regular close contact with each other that is so necessary in communities that are marginalized like this. So what is your message at this moment in time to those in the LGBTQ plus community regarding monkeypox, keeping themselves safe, but also recognizing that this isn't necessarily a widespread concern at this time in terms of community spread?
Right. I think we need to make sure that we get out in front of this. It is our responsibility to advocate whether that is with our senators, particularly our congresspeople, to put pressure on the federal government to get more vaccination made and distributed to cities around the United States before this gets a lot worse. And, you know, again, reminding our community that while this is not a gay disease, it is in our community. And we need to be realistic about that. We need to be safe about that. And we need to work together to stay out in front of this disease.
So Dave, can I ask
you from Affirmations? Oh, please, Larry, go ahead.
Excuse me, Scott. Yeah, Dave, I just want to get, so what are you hearing from the LGBTQ plus community in Metro Detroit? Are people concerned about it, or is it still just kind of an afterthought right now?
I think people are becoming more and more concerned about it. You know, we're seeing stories around the United States, New York, Los Angeles, outbreaks in Texas, and it is something that especially gay men right now are talking a lot about. Not just the United States. I spent a week in Toronto and a week in Montreal, and I have a week here in Lisbon. That, like I said, I fly home tomorrow. Everyone in the gay community in these areas have all been talking about monkeypox. I'm seeing a lot of literature throughout the gay villages and the gay communities in those three cities, and I know that that's happening. I'm on the board of directors of Centerlink, which is the national LGBTQ community centers network in the United States, 350 community centers. And we're talking about this, and we're trying to get information out and posted without scaring people, but again, being realistic that this virus is prevalent in our community. Prevalent might be a little strong of a word, like you said. I don't want to scare people, but if we don't get out in front of this, and if we don't get vaccination, and if we don't get those people vaccinated, I think things could get worse.
We're joined by Dave Garcia. He is one of the members of the Oakland County Taskforce to prevent monkeypox. That was just announced this morning from Dave Coulter, the Oakland County executive, in a press conference. That will be on our website, civiccentertv.com/megacast this afternoon. Speaking on vaccines, just for reference, as Executive Coulter had mentioned, currently about 1,800 vaccine from the federal government, from the federal government's national strategic stockpile is in the state of Michigan. 340 of those currently in Oakland County. They are not using them for preventative measures. More is expected to be in the county, according to Executive Coulter's discussions with the federal government, with the CDC and the White House by August, and even more than that by October. But of course, that is a great timeline. We're joined by Dave Garcia from Affirmations, which is located in Ferndale and is a LGBTQ plus advocacy organization. You can learn more information from Affirmations by going to their website, goaffirmations.org. Dave, another couple minutes with you before we'll need to say goodbye today. Anything else at this time? Any other messages you have for the LGBTQ plus community, or more info we should know at this time on the task force?
Be safe, be smart. We will be putting all this information up on our website and getting it out to all of the community centers around the state of Michigan. In fact, we have a call on this today. So we will be distributing all the information that we have. I'm glad to see the leadership of Dave Coulter putting this task force together of experts in our county and around the area. If we work together and we communicate well and we can get that vaccine, we'll get out in front of this before it gets worse.
Goaffirmations.org is the website for Affirmations. Dave, appreciate you joining us.
Thank you all.
Dave Garcia from Affirmations, also a member of the Monkeypox Task Force in Oakland County. Currently, Oakland County leading the state in monkeypox cases. That being said, again, the numbers across the state not very high at this time, Larry. 19 confirmed cases in Michigan, 8 of those in Oakland County. Just kind of a couple of minutes here, Larry. We'll go through just some last minute information as well. The task force is working on determining the number of vaccines that are needed as they continue to lobby the federal government for a greater stockpile. 300 currently, and just over 300 vaccine currently in the Oakland County area. They're not being used for preventative measures at this time. And again, as we talk to Dave Garcia, and as we listen to the press conference from Oakland County, from members of the task force, from medical officials in the community that are playing a key role in this task force, particularly Dr. Paul Benson from the Be Well Center in Berkeley, this is not a gay disease. This is not an LGBTQ plus community specific disease. It is currently at this time more prevalent in that community than it is in other populations and other demographics. But that being said, that doesn't necessarily mean that this cannot be spread among other people. It is spread through contact with other individuals that have monkeypox, that have the rashes themselves. It could be a handshake. It could be a pat on the shoulder. It's more commonly been referred to as an issue that pops up through intimate contact, particularly through sexual contact. And all the more reason, and it was really interesting to see noted by Dr. Paul Benson, a message to doctors in the Oakland County area. Ask your patients more specific and more intimate questions about their sexual activity, about their number of partners, because what they don't tell you could be critical information in regards to how they treat you for monkeypox or help you prevent monkeypox and prevent further spread of it in the community as well. Of course, this full press conference from Oakland County will be available as part of our full Megacast archive later on today on our website, civiccentertv.com, on our Megacast page, where you'll also find all of our interviews from today, including our discussion with Dave Garcia. And then we highly encourage you to stay up to date on all the information you need to know on COVID-19, on monkeypox, and more on our local news page, civiccentertv.com. Top of the page is an Oakland County link. That will take you to the Health Division's COVID-19 specific webpage. You can also go to the homepage of Oakland County, oakgov.com, for updates and more information on the Monkeypox Task Force. We're going to take a break on your radio homes for the Megacast, 89.3 WBLD Orchard Lake and 88.1 WBFH Bloomfield Hills. On the other side, we will kick off the Michigan Megacast as we continue through the summer months, helping you stay safe in your home and outside, going over some potential summer hazards with Dr. Varun Vohra from the Michigan. You're watching and listening to the Michigan Megacast.
Let's savor these moments, made possible by the COVID-19 vaccine. Keep the dining out going by keeping yourself protected and your COVID-19 vaccines up to date. Can I ask you a question? Why do you want to get the COVID-19 vaccine?
I don't like getting sick. The virus will die. It will be easy to not catch it. Keep my family safe and keep playing soccer because I love being vaccinated.
What's your hope for everyone?
I hope everybody gets the vaccine to keep safe and strong. Be like happy, having fun everywhere. Everyone stay safe and hope you get the vaccine.
Wondering what to say to someone who's been sexually assaulted or abused?
I believe you. I'm so sorry this happened.
It's not your fault.
Confidential and anonymous help is available at the Michigan Sexual Assault Hotline. Connect with us 24/7. Call 855-VOICES-4 or text 1-866-238-1454 for help. Learn more at michigan.gov/voices4. Let's relish these moments, made possible by the COVID-19 vaccine. Keep the festivals going by keeping yourself protected and your COVID-19 vaccines up to date. Now that the vaccine is available for children 5 and up, why do you recommend it?
Kids are part of the community and they can spread COVID.
We're seeing both healthy children getting sick from the virus as well as children with underlying health conditions.
They can easily bring the virus home to other people that are vulnerable and make them sick as well.
This vaccine can change that and keep children safe.
It's essential that your children get vaccinated to protect them, to protect your families, and to protect those in the community around you.
Let's savor these moments, made possible by the COVID-19 vaccine. Keep the dining out going by keeping yourself protected and your COVID-19 vaccines up to date.
Welcome to the Michigan Megacast. I'm Tyler Kieft, welcoming you to our live 5 days a week look into all things Michigan. On this program, we'll talk to a number of different individuals from across the state of Michigan this hour, including medical professionals, nonprofit leaders, and more about things that are important to you right here in Michigan. Our first guest on today's edition of the Michigan Megacast, we're pleased to be joined now by Dr. Varun Vohra, the academic director and clinical toxicologist at the Michigan Poison Center. Dr. Vora, thanks for being with us today.
Thanks, Tyler.
Appreciate having you on. So we are, of course, in the middle of summer now, or just about through the month of July at the time that we are taping this. And that doesn't mean that the potential poison concerns or other hazards in the home and outside in Michigan go away, because we're already fully into the summer. What are some of the more common summer poison concerns in the home that people may run into?
Yeah, I think you kind of alluded to the fact that, outside the home, a lot of people are outside, the weather's a lot better. So things that are kind of associated with that would be things like, insect repellent as well. So especially with kids. So we want to make sure that, you're using those products only on your skin, and that adults and caregivers are the ones applying it to children. The common ingredient is usually DEET. So DEET, many people have probably heard of it. You want to make sure that if you are using a product like that or any other insect kind of repellent, that you're applying it only on the skin. You're not putting it on your hands. You're not putting it all over your face per se. And DEET, the active ingredient in many of those repellents, can be pretty toxic in higher concentrations. So you always want to make sure you want to look at the concentrations. Anything over 30% of DEET, you want to avoid using in young children, especially like infants. And then there are other alternatives available. So picaridin is another one that's pretty common amongst insect repellents and has shown to be relatively safer compared to DEET. And then on the other side, when people do get stung or bit by an insect or say like a bee sting, first and foremost, if anyone's having trouble breathing, whether you feel the airways closing or they have a lot of swelling in the neck or the face, you want to make sure you want to call 911, because that could be a true anaphylaxis. And if someone does have a known allergy, the use of an EpiPen, always have that handy, especially if obviously you have a known allergy. And in the event that you do get stung, there are certain ways that if you can see the stinger, you could use sort of a blunt edge of, say, like a credit card or some sort of object or a card to sort of try and pry that stinger loose if you can see it, and just kind of sort of scrape the surface of the skin if that's possible. Otherwise, there are barbecues happening, a lot of people picnicking, etc. So food safety is obviously an ongoing issue with grilling and barbecues. So making sure that you're keeping hot foods hot, cold foods cold, especially the colder foods. So things like when you get into meats, poultry, fish, things of that nature, making sure that you're storing them in separate containers from other food items. Also, when you're preparing them, making sure that you're preparing them away from the other food items that are going to be consumed, like fruits and vegetables, etc. Hand hygiene is going to be a really important component. Regularly washing your hands in between preparing different types of foods, especially when it comes to the meats. And never leaving, cold foods outside of a cooler for more than 1 to 2 hours, especially like, today or this past week has been really hot. So when it gets over 90 degrees, you want to make sure that you're keeping foods inside, or not keeping foods outside the cooler for more than an hour. And, with celebrations, fireworks is a big thing. I know we had the 4th of July, and, there's some more holidays that are going to be coming up where people are going to be celebrating with fireworks. So, July was National Firework Safety Month, actually. So always want to be on the lookout and vigilant when using fireworks in terms of safety. The little even sparklers that kids use can get really hot, so up to like 1,500 degrees Fahrenheit. So making sure that you're exercising more common sense and safety precautions, so not handling lit fireworks, keeping kids and everyone at a safe distance away from lit fireworks. Eye protection is always a good thing. Having a bucket of water nearby is really important as well. And in the event that fireworks are ingested for any reason, and that does happen, we do get calls about that at the Poison Center. Do not make anybody vomit. These products have pretty caustic or corrosive substances in them, different types of metals like barium, lithium, nitrates as well, which can be very irritating and damaging to the airways and the throat. Do not force vomiting. So call us or call 911 right away if that does happen, because it can be really serious, especially in kids.
We're joined by Dr. Varun Vohra from the Michigan Poison Center on the Michigan Megacast. You can find more information from the Michigan Poison Center by visiting their website at poison.med.wayne.edu, or just search Michigan Poison Center, including on the Wayne State University website. It is a service of Wayne State University. We're joined, of course, by their academic director and clinical toxicologist, Dr. Varun Vohra. Dr. Vora, also pretty interesting as there's so many people that are visiting our waterways in the state of Michigan, whether it be the Great Lakes or some of our many inland lakes. The state wants to warn on harmful algal blooms in the Great Lakes, and also on certain foams that do form on the shorelines of water bodies, and why people should be concerned about that. Can you give us some insight?
Yeah, I mean, that's been sort of a common thing, especially, in the state, like you mentioned, and these can be harmful. They can contain, certain types of bacteria as well. So we're always on the lookout for that. We do get calls about it every now and again, and we want to make sure that, in the event that they're, check with your local municipalities and regions to see whether there are sort of active algal blooms in those waterways or areas where people will be sort of vacationing or doing their getaways or their recreational times, and to avoid obviously ingesting that type of water. Be careful with kids when they're going into it, especially with pets as well, because they can be also susceptible. So check with your local district as well, making sure that there are nothing identified in your local region. But otherwise, they can lead to certain complications. A lot of potential GI effects, more gastrointestinal, acutely, and then we want to avoid obviously any sort of bacterial infection with water, especially. So if you have any more questions or information, feel free to call us. The number is 1-800-222-1222. And we can obviously help with that in your specific region to see if there's any sort of areas to be wary of.
1-800-222-1222 is the phone number. Again, 1-800-222-1222 is the 24/7 free expert poison help from the Michigan Poison Center. We're joined by the academic director of the Michigan Poison Center, as well as a clinical toxicologist, Dr. Varun Vohra, on the Michigan Megacast. Dr. Vora, as kids are, of course, having busy schedules, much like adults in the state of Michigan, and of course with other stimuli in their life from devices and social media and whatever it be, some are having a lot of trouble falling asleep, and so they've turned to a substance known as melatonin, commonly used by adults as a sleep aid. Can you tell us about what parents should be aware of in terms of melatonin, if they're giving it to their kids, if their kids are taking it, and precautions people should take if they are taking melatonin to aid them in sleep?
Yeah, so there's a recent study that I was a part of, looking at sort of nationwide pediatric ingestions of melatonin, and by and large, we do get calls on melatonin, and for the most part, they're relatively benign ingestions and exposures. So I want to be clear about that. But there have been times where people have gotten in trouble with that, especially kids, where it can have more significant outcomes. Now, I think one of the most important things is letting caregivers and parents know that to make sure that you've talked to a healthcare professional, whether it's a physician or a pharmacist, beforehand, before giving it to anybody else or even taking it themselves. It is a dietary supplement still. So it kind of undergoes a different type of scrutiny and regulations compared to actual prescription medications. But making sure that it's indicated for the child, and you're adhering to the dosage recommendations provided by the healthcare professional and the label. You want to stick to the label in terms of the directions. And they come in different formulations. So there's solids, tablets, capsules, there's gummies as well, there's liquids. So we've seen with things like THC edibles in terms of gummy formulations, they can be really enticing to children. So same sort of principle applies here, where you don't want to leave them just out and about in front of kids unattended. You want to keep them out, up and away, out of their reach, because again, they can come in different colors. They can look like candy, common food items that they might be interested in. So it is a very popular supplement that has sort of skyrocketed in sales, especially in the last 10 years, especially in the US, which is predominantly the biggest sort of market worldwide for melatonin sales. So again, speaking to your healthcare professional, call us again. We have a lot of specialists and toxicologists that can provide further information about that. But by and large, the ingestions or exposures, the inadvertent exposures, are relatively benign. But again, if anybody does notice that their child is not behaving like they normally do, their mental status is sort of depressed and they're becoming more somnolent or sleepy, or what we call it, when not expected, or they suspect an ingestion, give us a call. And again, call 911 if there's any sort of question, whether they're having trouble breathing or they're unconscious or anything like that.
We're joined by Dr. Varun Vohra from the Michigan Poison Center on the Michigan Megacast. Again, if you have any of these sorts of issues or immediate concerns, call 1-800-222-1222, or of course, call 911 if there is an immediate emergency. The Michigan Poison Center number, again, 1-800-222-1222 for more information. Dr. Vora, another couple of minutes with you before we'll say goodbye today. Any other hazards or common issues that the Michigan Poison Center is currently getting more information about or hearing more about from residents in Michigan that Michiganders should be keeping aware of?
Right. So I think, with being outdoors, whether that's, common recreational areas, even golf courses, things of that nature, there's a lot of pesticides that are applied to those areas. So you want to make sure that you're avoiding skin contact with those things, with those items or those products. Especially you want to make sure that you're not applying them when pets are present. So if people are applying them in, say, your backyard or wherever it is, you want to keep pets out of that area. And if you do get it on your skin, make sure that you're washing it off immediately. And if you have any further irritation or any concerns, again, call us and we can help guide you through what the next steps are. Sort of in the same line as barbecuing and grilling, a lot of torch fuel and lighter fluid is present because of that. So these are known as hydrocarbons. So these can be very sedating if ingested inadvertently. They can be a choking hazard. People can aspirate these, meaning when things get accidentally enter the airways and the lungs, which can be a really, really serious issue. So you want to keep these away from kids, especially you want to keep them away from other flammable objects, just like fireworks. And in the event that a child does ingest it, we do get calls, we see cases about them at the bedside. They will have sort of a sleepy sort of disposition. Their mental status will be depressed because that's what it can cause sedation and increase that choking and aspiration risk. Do not force vomiting in anybody with these kind of ingestions or any type of ingestion. Call us first, or in the event of an acute emergency, call 911. Otherwise, people on boats, especially outside on the waterways now, is always a concern with carbon monoxide. A lot of people don't realize that boats are significant emitters of carbon monoxide, especially so hanging around by the back of the boat. You don't want to be back there too long while the boat's on. And, grilling, going back to grilling, avoid grilling inside closed spaces because that's also another carbon monoxide risk. So you want to make sure that's well ventilated and you're outside while doing it.
1-800-222-1222 is the number for the Michigan Poison Center for non-acute emergencies involving potential poisoning or other hazards. 1-800-222-1222. Or if you are having, as Dr. Vora said, experiencing an acute emergency, as always, we encourage you to call 911. Dr. Vora, thanks for joining us today.
Thanks, Tyler.
Appreciate having you on. You can learn more information on wayne.edu or just search the Michigan Poison Center for more information on common hazards and other safety education from the Michigan Poison Center. We're going to take a break on the Michigan Megacast. When we come back, grab your jorts and get ready to party for a good cause. We'll be joined next with Michelle Carravallah, the organizer of the Jean Short Party located in Ferndale. That's up next. You're watching and listening to the Michigan Megacast.
Wondering what to say to someone who's been sexually assaulted or abused?
I believe you. I'm so sorry this happened.
It's not your fault.
Confidential and anonymous help is available at the Michigan Sexual Assault Hotline. Connect with us 24/7. Call 855-VOICES-4 or text 1-866-238-1454 for help. Learn more at michigan.gov/voices4. Let's relish these moments, made possible by the COVID-19 vaccine. Keep the festivals going by keeping yourself protected and your COVID-19 vaccines up to date. Now that the vaccine is available for children 5 and up, why do you recommend it?
Kids are part of the community and they can spread COVID.
We're seeing both healthy children getting sick from the virus as well as children with underlying health conditions.
They can easily bring the virus home to other people that are vulnerable and make them sick as well.
This vaccine can change that and keep children safe.
It's essential that your children get vaccinated to protect them, to protect your families, and to protect those in the community around you.
Let's savor these moments, made possible by the COVID-19 vaccine. Keep the dining out going by keeping yourself protected and your COVID-19 vaccines up to date. Can I ask you a question? Why do you want to get the COVID-19 vaccine?
I don't like getting sick. The virus will die. It will be easy to not catch it. Keep my family safe and keep playing soccer because I love being vaccinated.
What's your hope for everyone?
I hope everybody gets the vaccine to keep safe and strong. Be like happy, having fun everywhere. Everyone stay safe and hope you get the vaccine.
Wondering what to say to someone who's been sexually assaulted or abused?
I believe you. I'm so sorry this happened.
It's not your fault.
Confidential and anonymous help is available at the Michigan Sexual Assault Hotline. Connect with us 24/7. Call 855-VOICES-4 or text 1-866-238-1454 for help. Learn more at michigan.gov/voices4. Let's relish these moments, made possible by the COVID-19 vaccine. Keep the festivals going by keeping yourself protected and your COVID-19 vaccines up to date.
Welcome back to the Michigan Megacast. I'm Tyler Kieft, welcoming you back to our live 5 days a week look into all things Michigan. More information can be found on our program as well as all of our partnering TV, radio, and web outlets that join us every day on civiccentertv.com on our Megacast page. Joining us now on the Michigan Megacast is the organizer of the Jean Short Party in Ferndale. Michelle Carravallah joins us now on the Megacast. Michelle, thanks for being with us today. Looks like we are experiencing some technical issues with Michelle. We'll stand by for now, and while we're waiting on those to be resolved, I want to give you some information on where you can get more resources on COVID-19 and other headlines across the state of Michigan. You can find that on our website, civiccentertv.com, on our local news page. Our local news page at the very top has links to the Centers for Disease Control and Prevention, the Michigan Department of Health and Human Services, and the Oakland County Health Division's COVID-19 specific web pages to help you keep up to date on everything that you need to know about COVID-19 in your community, whether it be in southeastern Michigan and the northern UP and Michigan, on the west side of the state, on the shore of Lake Michigan. COVID-19 is different in every single community, so we have those links from the MDHHS and the Oakland County Health Division, as well as the Centers for Disease Control and Prevention, to help you keep up to date on everything you need to know about the spread of COVID-19. In addition, we post headlines every single day, making news across the great state of Michigan, so that you have more information on everything that's going on beyond the COVID-19 front, and sometimes, of course, including information on COVID-19. It's something that we want to make sure we keep you up to date on everything happening across the Great Lakes state on the COVID-19 front and far beyond. You can find more information, as I mentioned earlier, on all of our partnering stations. We have partnering stations across the state of Michigan, providing great local community programming in various areas of Michigan, many in Oakland County, as well as statewide outlets such as My Michigan TV, which you can find at mymytv.com. It's our co-flagship for the Michigan Megacast every day, 11 a.m. until 12 noon. We'll take a quick break. We'll take care of some of those technical issues, and when we come back, we'll continue with more. This is the Michigan Megacast.
Now that the vaccine is available for children 5 and up, why do you recommend it?
Kids are part of the community and they can spread COVID.
We're seeing both healthy children getting sick from the virus as well as children with underlying health conditions.
They can easily bring the virus home to other people that are vulnerable and make them sick as well.
This vaccine can change that and keep children safe.
It's essential that your children get vaccinated to protect them, to protect your families, and to protect those in the community around you.
Let's savor these moments, made possible by the COVID-19 vaccine. Keep the dining out going by keeping yourself protected and your COVID-19 vaccines up to date. Can I ask you a question? Why do you want to get the COVID-19 vaccine?
I don't like getting sick. The virus will die. It will be easy to not catch it. Keep my family safe and keep playing soccer because I love being vaccinated.
What's your hope for everyone?
I hope everybody gets the vaccine to keep safe and strong. Be like happy, having fun everywhere. Everyone stay safe and hope you get the vaccine.
Wondering what to say to someone who's been sexually assaulted or abused?
I believe you. I'm so sorry this happened.
It's not your fault.
Confidential and anonymous help is available at the Michigan Sexual Assault Hotline. Connect with us 24/7. Call 855-VOICES-4 or text 1-866-238-1454 for help. Learn more at michigan.gov/voices4. Let's relish these moments, made possible by the COVID-19 vaccine. Keep the festivals going by keeping yourself protected and your COVID-19 vaccines up to date. Now that the vaccine is available for children 5 and up, why do you recommend it?
Kids are part of the community and they can spread COVID.
We're seeing both healthy children getting sick from the virus as well as children with underlying health conditions.
They can easily bring the virus home to other people that are vulnerable and make them sick as well.
This vaccine can change that and keep children safe.
It's essential that your children get vaccinated to protect them, to protect your families, and to protect those in the community around you.
Let's savor these moments, made possible by the COVID-19 vaccine. Keep the dining out going by keeping yourself protected and your COVID-19 vaccines up to date. Can I ask you a question? Why do you want to get the COVID-19 vaccine?
I don't like getting sick. The virus will die. It will be easy to not catch it. keep my family safe, and keep playing soccer. Because I love being vaccinated.
What's your hope for everyone?
I hope everybody gets the vaccine. To keep safe and strong. Be like happy, having fun everywhere. Everyone stay safe and hope you get the vaccine.
Wondering what to say to someone who's been sexually assaulted or abused?
I believe you. I'm so sorry this happened.
It's not your fault.
Confidential and anonymous help is available at the Michigan Sexual Assault Hotline. Connect with us 24/7. Call 855-VOICES-4 or text 1-866-238-1454 for help. Learn more at michigan.gov/voices4. Let's relish these moments, made possible by the COVID-19 vaccine. Keep the festivals going by keeping yourself protected and your COVID-19 vaccines up to date. Now that the vaccine is available for children 5 and up, why do you recommend it?
Kids are part of the community and they can spread COVID.
We're seeing both healthy children getting sick from the virus as well as children with underlying health conditions.
They can easily bring the virus home to other people that are vulnerable and make them sick as well.
This vaccine can change that and keep children safe.
It's essential that your children get vaccinated to protect them, to protect your families, and to protect those in the community around you.
Let's savor these moments, made possible by the COVID-19 vaccine. Keep the dining out going by keeping yourself protected and your COVID-19 vaccines up to date. Can I ask you a question? Why do you want to get the COVID-19 vaccine?
I don't like getting sick. The virus will die. It will be easy to not catch it. Keep my family safe and keep playing soccer. Because I love being vaccinated.
What's your hope for everyone?
I hope everybody gets the vaccine. To keep safe and strong. Be like happy, having fun everywhere. Everyone stay safe and hope you get the vaccine.
Welcome back to the Michigan Megacast. I'm Tyler Kieft, welcoming you back to our live 5 days a week look into all things Michigan. Joining us now on the Michigan Megacast is Michelle Carravallah, the organizer of the Jean Short Party, which will be in Ferndale. Michelle, thanks for joining us today.
Thanks for having me, Tyler.
Appreciate having you on. So first off, this particular party has a difficult origin, and an unfortunate origin. It goes back to the death of a friend of yours, Dave Thomas, who died by suicide in 2015. First off, tell us about Dave and how his life inspired this celebration.
Dave is a difficult person to describe unless you knew him, but he was very, very quirky and fun and so talented. He's incredibly intelligent, very, very funny, and just an all-around kind of blast of a human being. He always had the most fun ideas, and we always had the most fun when he was around.
And so as you're planning this event in Dave's memory, and you're coming up with something to make a fun event that's kind of quirky, that's very fun, that's very out there, that invites a lot of people to come in and just let loose, where did the idea for the Jean Short Party come in?
That was Dave's idea. So we started having the Jean Short Party, or he started throwing the Jean Short Party 12 years ago. And he wanted to have it on a Sunday when the band that I used to be in was playing there every Sunday, and he would have it at Luna in Royal Oak. And his only rule was that everyone had to wear jean shorts to the party, and that he wanted to eat Hot Pockets. So those were his only rules, and he would just do a Facebook invite, and everybody would show up in jean shorts and cut them shorter as the night went on, and it just made for a silly night. So we had the party for 5 years before Dave passed away, and then after he passed away, it was just a decision on my part and some of his friends to continue having his birthday party, but to charge entry fee and give that fee to Suck It Suicide so they could make some money so hopefully people wouldn't be going through what we were all going through, losing Dave.
So when you would talk to Dave about this party, was there any rhyme or reason from him for why jean shorts and were the requirement?
There's never rhyme or reason for most of the things that Dave did. It's just the idea was always to just do the silliest thing possible. So that was apparently in the moment 12 years ago, the silliest thing that he could think of. So that's what we do.
And so it continues on to this day. The Jean Short Party coming up in Ferndale. That will be on Sunday of this week, Sunday, July 24th, 6 p.m. It will be located in the Parliament Room at Otis Supply. That is on East 9 Mile Road in Ferndale. It's hosted by the Ryan and Michelle Show, Carravallah and Ruiz's 80s acoustic cover band. Tickets $10 per person in advance, $15 at the door. So if people would like to get tickets in advance, Michelle, how can they do that?
They can go to the Ryan and Michelle Show website, and it's just ryanandmichelleshow.com. And there's a bunch of very obvious links on the site to the Jean Short Party and where you can get tickets for it.
So obviously the jean shorts are going to be required for this party. What other activities will be happening at this year's Jean Shorts Party?
To be clear, we're not going to not let you in the door if you're not wearing jean shorts. Okay. But if you are wearing jeans, you risk having them cut off day of. So, but also for this year in particular, we've just really stepped up the party a lot. We have more performers. Drew Machik performing. We have Anthony Rapido is going to be in the house. He's a magician. He's incredible. So I can't wait for everybody to meet him and see him. And then the Underdog is going to be playing per usual. We have a really great photo booth, a really cool memorial wall. Just overall, Otis Supply, I think, is a really great fit for us. This is our first year having it there. So I'm excited for that.
And so, of course, this is a party that's now in memory of Dave Thomas, who died by suicide in 2015. And the proceeds are going toward suicide prevention efforts in the community. What organizations, or what causes necessarily are these funds from this party going towards?
So the funds go directly to Suck It Suicide, and Suck It Suicide is the education and outreach program of 6 Feet Over. And 6 Feet Over is a organization that helps the families that have lost them from suicide to deal with the costs and what happens when that happens, and to help them get through that really hard time in their life. But so all the money goes to Suck It Suicide, and they've got I think currently 4 families on the wait list for help. So we really need to raise a lot of money this year to make sure those families get the help they need.
They're a great cause and a lot of fun, too, in Ferndale. That's, again, this event, the Jean Shorts Party, Sunday, July 24th in the Parliament Room at Otis Supply. That is East 9 Mile Road in Ferndale. It's hosted by the Ryan and Michelle Show. RyanandMichelleShow.com is the website to purchase tickets in advance. RyanandMichelleShow.com. $10 for tickets in advance, $15 at the door. And again, that's Sunday, July 24th at 6 p.m. You do need to be 21 years old in order to attend. Michelle, just another few minutes with you
sure.
Before we'll need to say goodbye. Anything else that people should be ready to anticipate when they come to this party, or be excited to see at this year's Jean Shorts Party in Ferndale?
Like I said, I just say this year we're stepping it up so much. We have a huge raffle too this year. I mean, I can't imagine that it was going to be a problem in my life that we would have too many raffle items, but we have too many really, really great raffle items this year. And also, it's completely possible to watch the show online, to donate, and to participate in the raffle online. And all of those links are also available at ryanandmichelleshow.com day of. And the raffle actually opens on Friday, so you can go and check everything out and even buy tickets starting tomorrow. So that raffle is going to be massive. I can't wait to see what comes out of that. And people are going to win some really cool stuff. So we're so lucky.
Join the raffle, join the party at ryanandmichelleshow.com. We've been joined by Michelle Carravallah, the organizer of the Jean Short Party, which will be in Ferndale Sunday, July 24th in the Parliament Room at Otis Supply in Ferndale. Michelle, appreciate you joining us.
Thank you so much for having me, Tyler.
One more time, 6 p.m. at July 24th. That's this week, Sunday, in Ferndale at the Parliament Room at Otis Supply. $10 for tickets in advance, ryanandmichelleshow.com, or $15 at the door. We're going to take a break on the Michigan Megacast. When we come back, we'll talk with one of over 300 charities and nonprofits supported on the Share Detroit platform. That's up next. You're watching and listening to the Michigan Megacast.
Let's relish these moments, made possible by the COVID-19 vaccine. festivals going by keeping yourself protected and your COVID-19 vaccines up to date. Now that the vaccine is available for children 5 and up, why do you recommend it?
Kids are part of the community and they can spread COVID.
We're seeing both healthy children getting sick from the virus as well as children with underlying health conditions.
They can easily bring the virus home to other people that are vulnerable and make them sick as well.
This vaccine can change that and keep children safe.
It's essential that your children get vaccinated to protect them, to protect your families, and to protect those in the community around you.
Let's savor these moments, made possible by the COVID-19 vaccine. Keep the dining out going by keeping yourself protected and your COVID-19 vaccines up to date. Can I ask you a question? Why do you want to get the COVID-19 vaccine?
I don't like getting sick. The virus will die. It will be easy to not catch it. Keep my family safe and keep playing soccer because I love being vaccinated.
What's your hope for everyone?
I hope everybody gets the vaccine to keep safe and strong. Be like happy, having fun everywhere. Everyone stay safe and hope you get the vaccine.
Wondering what to say to someone who's been sexually assaulted or abused?
I believe you. I'm so sorry this happened.
It's not your fault.
Confidential and anonymous help is available at the Michigan Sexual Assault Hotline. Connect with us 24/7. Call 855-VOICES-4 or text 1-866-238-1454 for help. Learn more at michigan.gov/voices4. Let's relish these moments, made possible by the COVID-19 vaccine. Keep the festivals going by keeping yourself protected and your COVID-19 vaccines up to date. Now that the vaccine is available for children 5 and up, why do you recommend it?
Kids are part of the community and they can spread COVID.
We're seeing both healthy children getting sick from the virus as well as children with underlying health conditions.
They can easily bring the virus home to other people that are vulnerable and make them sick as well.
This vaccine can change that and keep children safe.
It's essential that your children get vaccinated to protect them, to protect your and to protect those in the community around you.
Let's savor these moments, made possible by the COVID-19 vaccine. Keep the dining out going by keeping yourself protected and your COVID-19 vaccines up to date.
Welcome back to the Michigan Megacast. I'm Tyler Kieft, welcoming you back to our live 5 days a week look into all things Michigan. More information can be found on the program by visiting our website at civiccentertv.com and clicking on our Megacast link, where you'll find information on our entire network of stations, including My Michigan TV. Joining us now on the Michigan Megacast is one of over 300 charities and nonprofits supported on the Share Detroit platform. Barrie Brown is the Community Outreach Manager at Seedlings Braille Books for Children, joining us on the Michigan Megacast. Barrie, thanks for being with us today.
Hi, thank you for having me.
Appreciate having you on. For some background information on the origins of Seedlings as well as who it serves.
Sure. So Seedlings was founded in 1984 by Deborah Bondi. At the time, Braille books were very scarce and expensive, some costing over $100 a piece. And so her goals, when she created it, was to increase the availability and lower the cost of Braille books for children with vision loss in order to promote literacy skills and a love of reading for them. And in 1985, which was her first year of production of Braille books, Deborah made 221 books. In 2021, with a small staff and our very dedicated group of volunteers, Seedlings produced over 35,300 Braille books and articles, and we've given away 63% of that for free. And a grand total of 663,555 since 1985.
And so what are some of these, how common is Braille book availability for those with vision loss in the state of Michigan? Is it common for most books that are being used, either textbooks for schools or just general reading books, to be also in Braille and be widely available to those in this community?
They're not always widely available. And so that's why Deborah created Seedlings, in order to produce books to create a love of reading. So we offer our baby board books, our print and Braille books, and our Braille only books for children ages 0 to 21.
And so among those services and programs are offering those books to these individuals. How do they end up in contact with the organization? Are you reaching out to them? Are they reaching out to you, some vice versa?
It happens both ways. We reach out to them in various ways, and then they also know us. They can order books online. Both families can. We work with many different schools for the blind and other organizations across the United States, as well as various organizations.
We're joined by Barrie Brown on the Michigan Megacast. She is the Community Outreach Manager for Seedlings Braille Books for Children, joining us on the program. You can find more information in a couple of places. Firstly, shareddetroit.org. You'll find information on over 300 other charities and nonprofits. Just go to their Find a Nonprofit section and search for Seedlings Braille Books for Children. You'll find more information. You can also go to their website, which is seedlings.org, seedlings.org, for more information. And as you said, Barrie, these books typically are not widely available in Braille for individuals with vision loss or those in the blind communities in our state. And so, as you're providing these books to them to try to foster a love of reading, or to give them the information that they are entitled to, as we all are through our education and in other capacities, how does the production of those books go? Because if they're not being widely produced by the production of those books on a mass scale level, who are you going to then? Who do you turn to as an organization to produce these materials for your clients?
So we produce everything in-house. We're located in Livonia, right off of Farmington Road. And so our baby board books, we actually get from publishers. So they're like any other board book that you'd find, at a local bookstore. And then we add the Braille embossable to them. And then we produce them here and we sell them. And then we also produce our print and Braille books, which have a line of print and then Braille underneath it. And we do all of the production here for those, as well as our Braille only books.
And so tell us about some of the other programs that are involved. They're helping people in these communities receive these materials. You have an Adopt a Reader program. Can you give us some information on that and how people can participate?
We do. So our Adopt a Reader program is available to children ages 0 to 21 with vision loss who are in 4 states. So Michigan, Illinois, Indiana, and Ohio. And the donor for $100, they can donate the $100, and then the child is able to
It appears we're experiencing some technical difficulties with Barrie, so we will continue on here in the Megacast. We're joined by Barrie Brown, the Community Outreach Manager for Seedlings Braille Books for Children on the Michigan Megacast. More information in a couple of places. ShareDetroit.org, ShareDetroit.org. We can find more information not only on Seedlings Braille Books for Children, but also 312 other charities and nonprofits all across Michigan on the Share Detroit platform. You can also find more info on Seedlings by visiting their website at seedlings.org. That's seedlings.org for more information, including how you can join their Adopt a Reader program. It appears now we do have Barrie back with us. Barrie, we appreciate you joining us. Another program that's coming up is the Fall Online Auction. How can people get involved with that, and how does that help Seedlings Braille Books for Children?
So our fall online auction is our biggest fundraising event of the year. Our goal is to raise $50,000 to provide 5,000 Braille books to children with vision loss across the country. It will be held November 7th through the 13th, and people can get involved by donating a gift card or gift certificate to the auction. And businesses, we also have some sponsorship opportunities available. And everything can be found on our website too, under our events page.
Seedlings.org. Just click on the events page for more information on the fall online auction, as well as how you can get involved and sponsor this as well. So you mentioned the goal for the fall auction is $50,000 for 5,000 Braille books for children with vision loss and for blind children as well. On a book-to-book scale, because these aren't being mass-produced, and even with them being produced in-house, maybe not being produced on a significant scale, just how much of an expense is it for your organization in-house to produce these materials for your clients?
Well, all of our donors, so with the help of our donors and grants and funding such as that, we're able to provide these Braille books for free or a low cost. We try to keep them low, $10 a book or less, or for free.
Seedlings.org is the organization's website. You can also visit shareddetroit.org for a lot of more information on a number of different charities all throughout the Detroit area and around the state of Michigan. Shareddetroit.org includes a lot of details, including how to get in contact with these organizations, their websites, their phone numbers, volunteer opportunities, items that they need donated to these organizations in order to help them provide the services that they provide, events coming up, and so much more. You can learn more about Seedlings Braille Books for Children by visiting shareddetroit.org, and of course going to their website as well, seedlings.org. That is seedlings.org for more information. You mentioned the opportunity for sponsorship for some of the programs, including Adopt a Reader and producing some of these books with the aim of $50,000 for the fall online auction to produce about 5,000 books. What are some other opportunities people have in the community if they don't have necessarily the financial means to support this organization, but they'd like to help out? Are there volunteer opportunities?
We do offer volunteer opportunities from time to time. Also, in producing our books, we rely on our volunteers heavily for producing them and getting them out. And then the other, sometimes people want to donate for even a small amount, $10, they can donate in honor or memory of someone, and their name will be inscribed in a Braille book. So it's nice to pass that along to someone, either as a birthday or memorial or any other reason.
We're joined by Barrie Brown, from Seedlings Braille Books for Children. She is the community outreach manager for this organization. It's one of over 300 charities and nonprofits supported on the Share Detroit platform. Again, you can find more information by going to seedlings.org. Seedlings.org is their website, including all their free programs, readers and volunteer opportunities, and other information on how these services are so critical for kids. And so since the organization was founded, Barrie, just how many kids have been impacted by the work of your organization to provide these materials to them in Braille so that they can read and develop a learn for reading and, of course, have access to knowledge in a way that many of us take for granted?
I mean, thousands of kids have been helped across the country and across the world. We shipped books all over the world as well. So thousands and thousands of kids have been helped and are receiving Braille books or have received Braille books.
Well, Barrie, we appreciate your time. A couple more minutes with you today before we'll need to say goodbye. Anything else at this time that would be important for our audience to know or to keep in consideration about Seedlings Braille Books for Children?
We are just, so grateful to our many donors and supporters and volunteers. They're what keeps us going and allowing us to send Braille books out to kids across the country. And they're truly paving a road to literacy for kids with vision loss.
Barrie, we appreciate your time. Thank you so much for joining us.
Thank you for having me.
Seedlings.org or sharedetroit.org for more information on Seedlings Braille Books for Children. We're going to take one final break on the Michigan Megacast. When we come back, we'll briefly wrap things up, give you some information on all the resources that we provide through the Megacast, including our archives and more information on news and headlines across the state of Michigan and more. That's coming up next. This is the Michigan Megacast.
Now that the vaccine is available for children 5 and up, why do you recommend it?
kids are part of the community and they can spread COVID.
We're seeing both healthy children getting sick from the virus as well as children with underlying health conditions.
They can easily bring the virus home to other people that are vulnerable and make them sick as well.
This vaccine can change that and keep children safe.
It's essential that your children get vaccinated to protect them, to protect your families, and to protect those in the community around you.
Let's savor these moments, made possible by the COVID-19 vaccine. Keep the dining out going by keeping yourself protected and your COVID-19 vaccines up to date. Can I ask you a question? Why do you want to get the COVID-19 vaccine?
I don't like getting sick. The virus will die. It will be easy to not catch it. Keep my family safe and keep playing soccer because I love being vaccinated.
What's your hope for everyone?
I hope everybody gets the vaccine to keep safe and strong. Be like happy, having fun everywhere. Everyone stay safe and hope you get the vaccine.
Wondering what to say to someone who's been sexually assaulted or abused?
I believe you. I'm so sorry this happened.
It's not your fault.
Confidential and anonymous help is available at the Michigan Sexual Assault Hotline. Connect with us 24/7. Call 855-VOICES-4 or text 1-866-238-1454 for help. Learn more at michigan.gov/voices4. Let's relish these moments, made possible by the COVID-19 vaccine.
Welcome back to the Michigan Megacast. I'm Tyler Kieft, welcoming you back to our live daily 5 days a week look at all things Michigan. This is unfortunately the end of our program today, as we are just a 2-hour program, 1 hour for the Oakland County Megacast, excuse me, and then 1 hour for the Michigan Megacast. Of course, if you're just tuning in now, you can view the full episode on demand this afternoon on civiccentertv.com by going to our Megacast page. Click on Megacast, and there we have information on all of our partnering TV, radio, and web outlets that join us every single day, some for the full 2 hours of the Oakland County and Michigan Megacast, some for just 1 hour or the other, but we appreciate them tuning in every day, and I encourage you to check out some of their other original programming supporting local communities all throughout the Great Lakes State. In addition, you can find all of our programs on demand by clicking on Watch Full Episodes, and find each individual interview on demand by visiting our website at civiccentertv.com/megacast and clicking on Watch Full Interviews. If you're really interested in what's going on with Oakland County's response to monkeypox and them forming a task force, how that affects specifically the LGBTQ plus community, you can view Larry Nilan and my interview with Dave Garcia from earlier today on the Megacast by going to that webpage. If there's other topics that are of interest to you, if you are an advocate for many of the charities and nonprofits across the state of Michigan and want to see more information on another great charity from Shared Detroit that we've had on the Megacast, you can find that on the individual interviews page. No matter how you want to watch the Megacast, live to tape, on demand, however you watch us, you can always find us on civiccentertv.com/megacast. Also, highly encourage you to go to our local news page on civiccentertv.com for up-to-date information from public health organizations federally, statewide, and locally on COVID-19, as well as headlines from many newsmakers and news outlets all across the state of Michigan. civiccentertv.com on our local news page. We update that daily before our show. Big thank you to everybody that joined us on this edition of the Megacast. We appreciate the good people over at the office of Oakland County and the executive's office for helping us to participate in today's press conference on the Oakland County Monkeypox Taskforce. Also appreciate Dave Garcia for joining us on short notice all the way from Portugal to be on the Oakland County Megacast. Appreciate our Michigan Megacast guests as well, and encourage you again to find their interviews on civiccentertv.com/megacast. Big thank you as well to our crew that makes this program possible. Jared Clark and Calvin Brown at Master Control at the office of My Michigan TV, and of course our producer, the king of television, Larry Nilan. That does it for this edition of the Oakland County and Michigan Megacast. We'll return Friday with a new episode.